I was just talking to that couple in Las Vegas. They've already burned through their savings. They're unemployed. Today's jobless numbers underscore another consequence of living during this pandemic, the mental and emotional toll just associated with financial loss. Families are stressed out, not knowing where their next meal or paycheck are coming from. Many therapists are working overtime with people struggling through isolation and uncertainty. And now the public health group Wellbeing Trust says tens of thousands more people could die from what they call deaths of despair due to drug and alcohol abuse or suicide because the pandemic has exacerbated their current plight. And one group, Volunteers of America, is helping to address the despair with a program that will first target healthcare workers. So here to talk about this is Dr. Rita Brock. She's the Senior Vice President with Volunteers for America and the Director of the organization Shea Moral Injury Center. So, Dr. Brock, thank you so much for being on with me. And what do you say? How can you help folks who are so in need right now, who are feeling so financially vulnerable?
Well, I can understand that sense of distress and high stress is pervasive. People who are at the end of their ability to maintain lives that they had hoped to have can feel like failures. They can feel ashamed. And of course, in fear of what's going to happen in the future. And those feelings are normal. They're not a mental health disorder, but they're an intense kind of suffering. And without someone to talk to process, to try to calm yourself down, to get your sense of equilibrium back, it's really hard to function in the middle of such a huge crisis.
What few words of encouragement or understanding would you offer these people?
I would say that how you're feeling is normal. There's not anything wrong with you. It's really a consequence of living in a major crisis like this and not knowing what the future is going to be. And the best thing you can do for yourself is to take a little bit of time to just be with yourself, to be calm, to try to calm yourself down and talk to somebody. It could be a friend, it could be a minister, it could be a neighbor or a member of your family that you think will understand, and just talk about how you're feeling. That it is of itself can relieve some of the stress and strain, because if you keep trying to avoid the pain and you keep trying to just do whatever you're doing and keep working, and you don't take care of the stress that you're feeling, it will slowly wear you down to a point of despair.
So talk to me more about, we talk about moral injury, about what the Volunteers of America's online program, what they're doing, moral injury, what does that mean, and how are you all helping?
It means we're in the process of creating peer facilitated groups. So we're working to train some medical workers and long-term care workers to lead groups of their own peers. In other words, they're not therapists, they're just people who want to help their peers survive this process. And so we're teaching them how to run a group and ask questions about how people are feeling and help them find affirmations in themselves, and to give them some self-care tips for how to deal with stress so they can get through this, because we need them to get through this and survive, to pull our society back together.
Dr. Rita Brock, thank you, and thank you for all the work you're doing. Appreciate it.
Pleasure to be on. Thank you for having me.
Thank you.